you've joined.
Thank you.
So thanks very much to everyone who's already on the session. So as everybody hopefully knows, this evening we're going to be having a chat about the ESPriT2 clinical trial. I'm really pleased to have Priscilla with us for that conversation. Firstly, just some quick introductions. My name's Rozie. I'm a staff member with Endometriosis UK, and I'm also on the public and patient involvement group for this trial. So really pleased to be having this conversation with Priscilla. Priscilla, would you like to introduce yourself?
Yeah, of course. Thanks, Rosie. So I am Priscilla Fernandez, and I'm a specialist research nurse working for Professor Andrew Horn and Dr. Lucy Whitaker at the University of Edinburgh. My main role really involves speaking to patients on a daily basis with regards to the endometriosis and gynecological studies that are happening and that I'm being involved in Professor Andrew Horn's projects, and I also advise hospitals about how to conduct the ESPriT2 trial, which I believe we're going to be chatting about today.
Brilliant. Thank you, Priscilla. And again, it's just so great to have you with us. So a little bit of housekeeping. We have run a bit of a poll on our Instagram story. So if you have any questions about what we're discussing this evening, please feel free to submit those. I've got a second device here with me, so I'm going to be keeping an eye on any questions that are coming through. But just to start off with, I've got a few questions for Priscilla myself that I wanted to talk through, if that's all right with you.
Of course. Yeah, absolutely.
Great. So first of all, Priscilla, I think it would be really helpful for you just to talk us through what a clinical research trial is.
Sure. So a clinical research trial, I always say it in three different types. So clinical trials are types of research that basically are conducted to study new tests and also new treatments and evaluate existing treatments as well. And people can volunteer in different ways. You may have taken part in surveys, so that's kind of behavioral research that we're looking at. Medical research is more about looking at maybe new medicines for that condition. And then the surgical clinical research, which is what we're talking about today, which is part of the ESPriT2, is perhaps sometimes we test a new device during surgery, or sometimes we evaluate whether performing a certain surgery is beneficial and whether we should continue to do that or we should change our ways. So that's kind of like what clinical research is about, really.
That's really helpful, and thanks for talking us through the different examples. I guess in a nutshell, I'm taking from what you're saying, it's all about kind of using a clinical approach to finding answers to different questions, and it sounds like there are quite a number of approaches to that.
Absolutely. We always want to find what the best evidence-based research and care, so that basically we can say, you know, for example, COVID has been a great example. It's just we've been finding new vaccines, etc., new treatment options. So there's a lot of research going on about that. So it's about offering the best evidence-based care to our patients.
That's great, thank you. So ESPriT2, bit of a strange name. Can you tell us what it stands for?
Yes, we love the acronyms in the research world. And the reason for that is because ESPriT2 actually, I've written it down because the proper title is a multi-center randomized controlled trial to determine the effectiveness of laparoscopic removal, da-di-da-di-da. So in the research world, of course, if you wanted to dictate, discuss ESPRI, etc., you would be thinking that's a huge title. So we like to shorten them so it's easier for clinicians, but also for patients as well, because, you know, calling up and saying, I've read about that trial that you're doing for this and that the other, ESPRI2 is just a little bit easier to actually understand and identify. And basically, if you break it down, so E is effectiveness, the SP is the superficial peritoneal endometriosis, and the RI is peritoneal, sorry, and then T is trial. And then we've got a 2. And the reason for that is because we have conducted a smaller trial beforehand called ESPRI just on its own, and that was in Scotland, and there was 4 different sites, and that was a smaller version of this one. So this is why it's got a 2 at the end as well. But that's basically what it means. I wanted to clarify, if that's okay, that when we use the term superficial when it comes to endometriosis, it's basically dictating, it's not dictating what the severity of the symptoms uh, is at all, because as we know, the severity can, in endometriosis does not correlate with the severity of symptoms, depending on the staging that you may have. The staging is very useful for when we assess that in surgery, for example. So superficial means that it's lining those layers that are superficial, which are less than 5 millimeters deep. If it was a bit deeper than that, then we would consider that as deep infiltrating endometriosis. So it makes it sound less important, the superficial bit, but I promise you it's just a way to describe that so that we know what was found during surgery.
That makes total sense. And I think, am I right in thinking as well that that type of endometriosis, the peritoneal endometriosis, is the most common type? So actually, it's really important because it affects most of those who are living with the disease.
Absolutely. So I believe the numbers around 80% of endometriosis sufferers will have the superficial peritoneal type of endometriosis found during surgery.
Okay, that's great. And that gives us a little bit of a hint as to what the trial's about and what it's focused on. But could you tell us a bit more about what the trial is aiming to find out, and the approach it's taking for that?
Yeah, of course. So I've made a few notes so that I don't forget. But
Absolutely. Thank you for piling us with information. We need it.
that's okay. And please correct me if I forget anything. But we are trying to determine whether actually removing the endometriosis lesions in superficial peritoneal disease is actually what we should be doing. So basically, we need to find out whether it's clinically beneficial for women and their pain and quality of life. So the way that we're doing that is that we are assessing women's pain at the beginning before they've had their surgery. And then what's going to happen is we're going to randomly allocate the person to two different groups. One will have the peritoneal endometriosis removed, and the others will not. Everyone will have a diagnosis of endometriosis if indeed that's what you have, but 50% will go into the group where the removal happens, and 50% will go into the group that it doesn't happen. They will still do the full look around like they do. You will still be told as a patient after you come round from surgery that you do have endometriosis, if indeed that's the case. We can even tell you where it's located, but we won't be able to tell you whether it's been removed or not. And that's just to remove the bias of, because the way we're collecting the information is whether to see, we're doing a pain score of 0 to 10. Everyone on this call will be very familiar with a 0 to 10 and will have gone through it many times at baseline and then again at 12 months. And that's the main objective of the trial, to see. And if you knew, obviously, that you had the endometriosis removed, you may be slightly biased as to what that score may be. We also, along the line, we ask you to complete questionnaires at 3 months, 6 months, and then again at 12 months. And again, we love comparing in the research world, so we put all that information together. When the 12 months is up, then we would be able to tell you what arm you were allocated to, so whether you did indeed have your endometriosis removed or not, and then take it from there. During that time, the patients are allowed to access any medical treatments that they would like to explore with a clinician if they still have pain or experiencing symptoms as well. So, and the way we would go about doing that, if anyone is interested, I know that Rosie, you're going to put up a link in the bio, but if you're interested, please visit the ESPriT2 website, and that will give you more information. It may be that you may not be able to take part, or maybe this research doesn't fit you and you think, actually, that's not something that I'm willing to take a risk of not having the endometriosis removed, and that's totally fine. And research is ever changing. There will always be a research opportunity which is a good fit for you.
That's great. Thanks, Priscilla, for giving us such kind of a thorough overview of it. A couple of follow-up questions, if you don't mind, just from things people have asked me in the past about the trial.
Of course.
Does the trial take into account and record the skill level of the surgeon conducting the surgery?
Yeah, we do. So basically, the we do collect the grade of the surgeon performing the surgery. Um, we just collect it. We don't dictate that the surgeon performing the surgery has to be a specialist, or because that if we were to say all the top surgeons are going to undertake ESPriT2, and those are the surgeons who are going to operate on women taking part in this trial, it wouldn't be a true reflection of what happens across the UK. So, in reality, that would not happen. And if we suspect that the endometriosis is of peritoneal type, that may happen in a different hospital, a different hospital with a specialist. Maybe you're not near a specialist centre, etc. And it's not that you're getting lesser of removal or not. It's just we do record that, and that will allow us to actually break that down a bit more when we do analyse the results in the end as well.
That's really helpful. Thanks for sharing that. Possibly an associated question here. There's often a lot of talk around excision versus ablation surgery. Will the trial also be recording information around that?
Yes, so we're recording whether the surgeon has chosen to go with ablation, excision, or a combination of both. And basically, ablation means that the endometriosis would be burnt away, and excision would be that it would be cut away. And sometimes the surgeon will choose to use both depending on the location of the endometriosis. So again, we do collect it, but we do not dictate what method should be used. And then that way, again, we will be able to use that when we look at the results and say, this may be a better treatment option, or this may, or actually cutting it away can do more damage to the structures and can cause more pain in the long run. So I just think it's a really important research question, regardless of what the outcome is at the very end.
Yeah, really good to hear that that's been taken into account as well. Just a quick housekeeping note. I can see various comments popping up. They move very fast on Instagram Live. So just to remind people again, if you've got any questions, just so we don't miss them, there is a box just on our story where you can submit questions, and I'll be keeping an eye on that and making sure we answer as many as we can. So feel free to submit there. But in the meantime, Priscilla, I'm keen to kind of pick up on, so obviously the intent of the trial is to understand the effectiveness of surgical removal of this particular type of endometriosis, peritoneal endometriosis. So bearing that in mind, could you talk us through what the other treatment options are for endometriosis and management options beyond surgery?
Sure. So if you were interested in taking part and you did take part, you are allowed to explore medical treatments meantime as well. Like you quite rightly say, we just record these. So for example, if your surgeon thought it might be a really good idea to have, for example, a Mirena coil fitted during your surgery, that's perfectly fine. We would not interfere with that. Our idea is that we're going to mirror clinical care as much as possible. So we would not say you cannot have that. We would just record it and say you've had a Mirena, um, inserted during surgery, and that's totally fine. So obviously all the medical treatments, which I'm sure some viewers will be really familiar with, and can include, your painkillers, your hormonal treatments, coil implants, other things like Zoladex and Decapeptyl, which is kind of like what we class as the chemical kind of menopause. We would just record these as well. And we also really promote holistic treatments, like, for example, physio, acupuncture, aromatherapy, massage, anything that is going to help improve pain. That's perfectly fine. And we do ask you about these at 3, 6, and 12 months. Is there anything new that you're doing, so that we take that into account and consideration. There's also use of things like antidepressants, and what we must know is that we don't prescribe antidepressants because you're depressed. It's not to do with that. It's to do with repurposing an existing medication. So in the same vein that paracetamol, for example, can be a painkiller, but also can take a temperature away, is when we're using the antidepressants, because that can help. For example, if you get woken up in your sleep because of the pain, that can sometimes settle you for the night, for example, and it does help with nerve pain, etc., that may occur. And those are things that you can try, even if you took part in the trial.
Mm-hmm. That's great, Priscilla. And yeah, really good to kind of have that reminder around sort of the range of other treatment options that are available in terms of the hormonal, the pain management, and the kind of complementary therapy side of things as well.
Yeah.
That's really, really helpful. Could you tell us a little bit about where the trial's up to at the moment and what progress it's had so far?
Yeah, absolutely. So at the present time, we've actually consented 117 patients to the study. We have also had what is called 17 randomizations. And basically what that means is you're probably thinking, why do they have a really large pool of consents and then randomizations are, very little compared to that. But we're slightly behind because of COVID, and obviously there's been a lot of surgeries that have been cancelled, and it's just been absolutely rubbish for anyone on a waiting list who is watching us just now, who may have a long period to wait, 12, 18 months. So 117 ladies, we are hoping to total recruit 1,200 ladies, which is quite a large number. But we suspect we're probably going to need that number because we need 400 randomized patients. And what can happen with this trial is, because the randomization occurs during surgery, because it's the only way that we can actually, know whether for certain whether you've got this peritoneal disease, endometriosis. So at that time, it could be that you've got deep endometriosis, so we wouldn't be able to randomize you into the trial. It may be you have no endometriosis. It could be that you've got other findings that are not in the best interest to at that point randomize you into the trial. One of the things I forgot to say as well is we are because we can only see this usually the peritoneal endometriosis at surgery, we're also asking the ladies who are participating to provide us with a blood test, just a blood sample. We're testing it to see if there's any biomarkers, as we call them, but basically just to see if there's anything in the blood compared to women with who do not have the same findings, and whether we can actually see that from a blood test, which would be obviously life-changing, and it makes such a difference. So that's another thing that we're doing.
I think am I right in thinking that's called ESPriT2 Plus? So it's almost like a bonus extra that has been added onto the trial as a way to, a biomarker to try and improve our knowledge around methods for diagnosing the disease.
Absolutely, yeah. So, and one thing to mention is, if anyone who's watching would like to participate in ESPriT2 in particular, so the main part of the study, but they might be like, oh my God, I can't give blood on the day. We appreciate how nerve-wracking, worrying time it is, and can be the last thing, the straw that broke the camel's back would be a blood test.
There's already a lot going on.
That's totally fine. You do not need to participate in the blood taking sort of sample. You can still take part in the main study. It cannot be the other way around, unfortunately. And I'm sure we would have queues of ladies trying to give us blood if indeed we were able to do that. But you don't have to take part in the SP plus part of it either.
Thanks for flagging that. So that's a good thing to mention there, because you're totally right. There can be an awful lot going on the day of surgery, and that could be just one bit too far for people. But of course, great to include that for those who are sort of comfortable providing that blood sample as well.
Absolutely, yeah.
And can I ask a little bit about sort of eligibility for the trial, Priscilla? So you've touched on it already, obviously. So if someone was found to have sort of deep infiltrating endometriosis, they wouldn't sort of be eligible at that point. Anything else in terms of who's eligible to sign up for the study in the trial?
Yeah, so we dictate that you need to be aged over the age of 60. You are hopefully on a waiting list, undergoing laparoscopy for the investigation of chronic pelvic pain. You're able to give consent, written consent, and that you've never had a diagnosis of endometriosis via surgery. So, if there is if suspected endometriosis, then that's fine, because obviously that's why you're undergoing the surgery in the first place, to find that out. It could be that you've had a laparoscopy in the past for this investigation, but they didn't find endometriosis, and then your clinician has listed you for another one because it's been a number of years in between, and that's totally fine. You can take part as well. So basically, unfortunately, for anyone watching who has got a surgical diagnosis of endometriosis, you're not able to take part in this particular study. But like I say, we've got a study for everything and everyone. So, if you're willing to help in any way, we will find a good fit for you. It may not be right this second, but in the future anyway.
Yeah, absolutely. And I think that's a really good point, Priscilla. I've seen actually just a comment pop up on the chat here about somebody saying that they've actually got endometriosis, so then they've realised they're not eligible to take part, or they quite want to be involved in research. So just to say on that, if anyone has any further queries around other research projects, we'll be sharing more information from the Endometriosis UK website and social media in the coming days. But feel free also to email our research account, which is research@endometriosis-uk.org. And there, as Priscilla says, there are a number of research projects underway with different eligibility criteria as well. Priscilla, could you talk us through just quickly some of the sites that are taking part? Because I presume one of the eligibility criteria is that you have to be based or being treated at a participating NHS site. Have I got that right?
Yeah, absolutely. So we hope to have in the future 70 sites across the UK. At present, we've got 26, and I've got a list of the ones that we've got here, and I was really quickly going to read through them if that's okay.
Yeah, please go ahead, fire them out.
And with regards to eligibility, if you don't know, if you're thinking, actually, I've had a scan and maybe they've seen a cyst, etc., I don't know whether I'm eligible, please just give us a call, give the nurse a call, because we will be able to go through the eligibility inclusion criteria, as we call it, with you. We would never, put you forward for a study that we thought was not in your best clinical interest as well. So, and if there's any doubt, we can always kind of withdraw from that decision as well. So the sites, we have got quite a few at the moment, none in Wales at the moment, which we're dealing with at present. So we've got Glasgow, Barnsley, Oxford, Homerton, Royal Free London, Devon, Wishaw, Guys and St Thomas's, Norfolk and Norwich, Milton Keynes, Tameside, Edinburgh, Aberdeen, South Tyneside, Sunderland, Kirkcaldy in Fife, UCLH, so University College London, Stoke Mandeville, Telford, Burnley, Forth Valley, Portsmouth, Crosshouse, Birmingham Women's, Cornwall and Plymouth. And that's me. Sorry.
That's a nice long list there, Priscilla. But it's growing, isn't it? Because there's more sites that are actually joining the study because it's live, and so I presume people can kind of get in touch and keep an eye. And I presume on the ESPriT2, the study website, there's a list of the participating sites, so people can keep an eye on that as well.
Yeah, absolutely. So we've got a list of the sites, and also a contact email for you to get in touch with a nurse or midwife or clinician looking at that study at that site.
That's great. And just to say again, just so people know where to go after this live session, as we're not able to kind of share screens or anything this evening. In the first instance, if you're not sure, we have got a link in our bio. It's the top link, which gives a bit more information, particularly on this trial and the importance of it. So feel free to have a click on that. But also, as I say, if you're interested in getting involved and you're not quite sure which avenue to take or where to go with that, please feel free to email research@endometriosis-uk.org. I'm hoping that for most people listening, they know how to spell endometriosis, as we have to talk about it a lot as the community. But thanks so much, Priscilla. And anything else you want to sort of share that we've not covered off already there?
Um, I guess the last thing is to say, it's absolutely up to whoever's watching to decide whether they would like to take part or not, whether they're eligible to take part. If you sign up for ESPriT2 and you think, actually, I'm in a good position at the moment to take part, and things change, life changes, and it could be that your surgery doesn't happen for 12 months, and in those 12 months you think, actually, I've changed my mind. You can withdraw from medical research at any point without giving a reason and without your legal or medical treatment obviously being affected in any way. We just appreciate the donation, whether that's your time, being involved in research with regards to giving us a donation of a sample or something like that. So we just are always incredibly grateful to anyone who wishes to inquire more about the research studies. So don't be shy, drop us a line, and then we can direct you to the best place from there.
That's great. Thanks, Priscilla. And just to go to a few of the kind of questions that have popped up as we've been talking, a person has just asked us to kind of recap on why this isn't a study for deep infiltrating endometriosis. My understanding is that this particular trial is obviously just focused around trying to understand the effectiveness of surgical intervention for peritoneal endometriosis, because there's some evidence already around the effectiveness of surgical treatment of the sort of more deep infiltrating or further staged endometriosis, but we need further answers specifically on the peritoneal kind. Have I got that right, Priscilla? Anything that you'd add
Yeah.
there?
No, you're absolutely right. We do know there's more evidence regarding deep endometriosis, and also if, for example, you have got an endometrioma, we know that that improves pain because there's more evidence surrounding that rather than the more kind of like lower sort of amounts of research that has been already covered in superficial disease. So yeah, we just know that that works. We know that from patients, but we do know that a lot of patients do come back sadly with some pain or symptoms when it comes to peritoneal endometriosis. So we do want to find out whether we are doing the right thing. Are we removing it is the best way forward? Or in actual fact, we should just let it be and try with medical treatments, etc., and holistic approaches, etc.
Yeah, that makes total sense, Priscilla. Thank you very much for sharing that. And also just to say, if there was that question around sort of why this trial in particular isn't focused on that deep infiltrating endometriosis, just to clarify again that there are various research projects live and underway at the moment, and some of those focusing on sort of the effectiveness of treatment and treatment options for different kinds of endometriosis, including deep disease. So if you'd like any further information on that, I'll plug the email address again. It's research@endometriosis-uk.org. But we've also got contact details in our bio, so feel free to use those as well if you need them. Priscilla, I also saw another question that sort of popped up on the chat as it's been going on. I think we've sort of we've touched on this because it feels like it's the crux of the trial. Somebody kind of explaining that they have experienced kind of more severe pain having already had a laparoscopy and surgical treatment of their endometriosis, and sort of asking if that's normal, and possibly what the kind of options are beyond that. So obviously it feels like a little bit this is what the question we're trying to answer with this trial, as to whether that is normal for symptoms to reoccur, and to understand if surgical intervention is effective for this particular type of endometriosis, the peritoneal kind. But any thoughts kind of beyond that in terms of what sort of the treatment options and advice could be from your professional perspective?
Well, It's exactly what you have said, and what you've touched upon. And sadly, we're seeing this recurring pain, and we're wondering, are we actually doing more harm by actually removing these lesions of endometriosis by, is it burning away too much, too little? We just and leaving some behind. We just don't know. And from a clinical perspective, I think it's really important to speak to your GP, to your clinician, to a gynecologist as well. It could be that you've explored umpteen different things, and I'm just repeating what you already know. Sadly, with endometriosis, as you know, we do not have a cure, and that's another thing that we're looking in the research world as well, see if we can come up with something to improve quality of life. But yeah, just make sure that you've got a good team. Gynecologist would be ideal to actually visit and see what options are out there as well. Don't be scared to say, is there any research that I could be taking in? Because it could be that there is a medicine out there that they're trying a present in, that you think actually that you may be a good fit for this. And also ask what other options you may have. It could be that a pelvic physio, a physio who specializes in pelvic pain is just the answer. So yes, surgery and medicines are not always the best fit. And, it could be that acupuncture is the best thing since sliced bread for you. So go there, explore, and also look at the good websites like Endometriosis UK, endometriosis.org, to see what other options you may be able to look at.
That's great. Thanks, Priscilla. One question that's popped up is, and I know we're slightly over time and we will need to wrap up soon, but I think an important one possibly, if we can try and address it. So the question that's come up is whether endometriosis on the pouch of Douglas kind of counts as that superficial peritoneal disease. But I think it might also just be good for us if you could help us briefly clarify the different sort of types of endometriosis. So sometimes we hear about stages, stages 1 to 4. Sometimes we hear about minimal, mild, moderate, and severe. And then obviously sometimes we talk about deep disease. Would you just be able to very quickly just explain for us that sort of the different types and what that superficial peritoneal endometriosis is classed as?
Yeah, absolutely. So you're absolutely right. So we've got the 4 stages, and this does not correlate with the severity of symptoms. So you've got stage 1, 2, 3, 4. And as you say, you class it's minimal, mild, moderate, and severe. And also, that is just a way of describing it in a surgical sort of way. If the lesion is sitting below the 5 millimeter mark, so at 5 millimeters thick, then it would be classed as deep. And it could be that there's no disease seen in the peritoneal type. And there could be a lesion that, like a nodule, that is just sitting in isolation that is quite deep, and that would be classed as deep, but it's not widespread, if that makes sense. If there was, I believe, a lesion in the pouch of Douglas and it wasn't sitting very deep into the structures, then we would be able to randomize that patient if indeed it was not. If it was, for example, that we thought we're not sure, we would not continue with the study. We would just say, actually, it's in your best interest. It's during surgery time, but this decision would be made for you because it would be in your best interest to perhaps definitely have that removed because of, where it is. And if it was sitting quite, they didn't know whether it was deep. And if they thought, no, we're just going to remove this because clinically I feel that is definitely going to improve her pain, then we would follow the clinical sort of care as close as possible.
That makes sense. Thank you. A final question I've seen pop up that I think if we could very quickly answer it is there's a question from somebody who has experienced symptoms of endometriosis, and they've been given a diagnosis of endometriosis without a laparoscopy, or I presume suspected endometriosis. However, they as the patient would like to have a laparoscopy and that hasn't been offered to them. Just from your professional perspective around kind of the guidelines that there are in place, is somebody entitled to have laparoscopy if that's something that they want and they've already got a working diagnosis of endometriosis? How do they pursue that if they're having sort of trouble accessing it?
Sure. I mean, I think what's really important within the endometriosis community is validation. I think it's really important,
Yeah.
and for anyone's head to know that if that person feels, I really need to know, I need to have an answer, don't be scared to ask for a second opinion as well. You are entitled to a second opinion and just to ask for a different gynecologist. That gynecologist or GP, does not need to know why you have changed to another gynecologist, and you could pursue that way. Sometimes writing things down, writing an email explaining as to why you feel a laparoscopy would be beneficial to you, is sometimes very useful, because I feel if you have it all in writing, say, these are my symptoms, this is the other, and this is why I feel I would need a diagnostic laparoscopy, I think it's really beneficial. You can put that in writing, and if they continue to say no, as I say, second opinion, you can go that way. Obviously, there's always, the option of exploring other things privately, but to be honest with you, there's no need. You could just go, for a second opinion.
Yeah, absolutely. And obviously, everyone is entitled to care, and we have a wonderful NHS, and everyone should be able to access the care that they need through that. So I'm aware we're over time, so we'll try and wrap up there if that's all right with you. Priscilla, thank you so much for everything that you've shared. Just to recap then, so obviously the ESPriT2 trial, as we've talked about, is very much focused on trying to understand the effectiveness of surgical intervention for peritoneal endometriosis. If you are interested in being involved in the trial, in order to be eligible, Priscilla, please correct me if I have missed anything, you need to have suspected endometriosis, so to be experiencing symptoms and to be in the process of being referred to or having been referred for a laparoscopy. That would need to be your first sort of diagnostic laparoscopy, because you can't already have a diagnosis of endometriosis. So the other eligibility criteria is that you need to have not been diagnosed with endometriosis before in order to be eligible for this trial. Have I got that right? Have I missed anything?
Absolutely. No, perfectly.
Okay. And of course, you also need to be being treated at one of the many NHS sites that Priscilla mentioned. The list is growing, and sort of more information is available on the trial website about that. You can find more information on the trial on our via the link in our bio. And also, if you are interested in getting involved, need a recap of any of the information that we've shared, please feel free to email research@endometriosis-uk.org. Priscilla, anything you really are burning to add or add on before we finish up?
Not really. I just wanted to say thank you very much for anyone who has been watching us. And yeah, please speak to your research team if you'd like to. Go to your gynecologist, say, what research can I take part? Remind them, because we're always trying to find the best treatment options for endometriosis sufferers. So fingers crossed that we have good results from it all. So thank you so much for organising all this, Rozie, as well. You've been wonderful.
No worries at all. Priscilla, thank you so much again for joining us. And we look forward to keeping the endometriosis community informed about the various research that is underway on endometriosis, and keeping you guys informed on this trial in particular. Thanks everyone who's listened in and who's listening back to the recording, and I hope you all have a lovely evening. Take care, everyone. Bye-bye.
Bye.